Here today for the National Hospice and Palliative Care Month, correct? And this proclamation reads as follows. Whereas all people are encouraged to learn about options for care, options like hospice and palliative care before they are confronted with healthcare crisis, which to share such wishes through appropriate advanced care planning activities. Whereas hospice and palliative care empower people to live as fully as possible, surrounded and supported by family and loved ones, despite serious and life-limiting illnesses. Whereas hospice and palliative care bring patients and family caregivers the highest quality of care delivered by interdisciplinary team of skilled professionals that include physicians, nurses, social workers, therapists, counselors, health aides, spiritual care providers, and others who make the wishes of each patient and family a priority. Whereas advanced care planning involves making decisions about the health care an individual would want to receive if he or she were facing a serious or life-limiting illness, or if they were unable to speak for themselves. Whereas through pain management and symptom control, caregiver training and assistance, and emotional and spiritual support, allowing patients to live fully up until the final moments, surrounded and supported by the faces of loved ones, friends, and committed caregivers. Hospice and palliative care focus on quality of living. Whereas each year hospice saves Medicare more than $2 billion by providing solutions for physicians, caring patients, and comfort to families anywhere at any time. Whereas every year more than 1.65 million Americans living with life-limiting illness and their families receive care from the nation's hospice programs and communities throughout the United States. Whereas more than 430,000 trained volunteers contribute 19 million hours of service to hospice program annually. Whereas hospice and palliative care providers encourage all people to learn more about options of care and to share their wishes with family, loved ones, and their healthcare professionals. Now therefore, be it resolved that I, Brian Wyndham, Mayor of Brazil, Indiana, by virtue of the authority vested in me, do hereby proclaim November 2016 as National Hospice and Palliative Care Month, and encourage citizens to increase their understanding and awareness of care at the end of life, and to observe this month with appropriate activities and programs.